Here we are again at Special Hospital Sveti. Today, our topic will also be dedicated to children. I think this population deserves the best attention. The greatest negligence in our country is the failure to timely discover changes in the cornea in children, and in case these are dystrophic changes localized superficially, excimer laser treatment can be applied. It's already been said that excimer laser is not only used for diopter correction, but it has a much wider application in the treatment of superficial corneal changes, as this type of blur may cause amblyopia in children, which means the impossibility of developing full visual function. In children, in addition to the removal of these superficial changes, there's often the possibility to perform the refractive procedure simultaneously if any refractive error has been registered. This comprises PTK, phototherapeutic keratectomy, and photorefractive keratectomy, or PRK, which we have already performed in our institution. It often happens that children get viral infections after which superficial blur may remain, which means a superficial scar in the cornea or a corneal erosion or corneal injury that will end in a superficial scar. In such situations, visual acuity decreases, vision becomes impaired, and the correction with contact lenses or glasses isn't possible. The blur must be removed and previous visual function must be restored. Again, PTK, phototherapeutic keratectomy, may be applied in such cases of superficial damages of the cornea or corneal scars after viral infections, the most common infection being herpetic infection. It should be explained to parents how their child can see through corneal blur in the superficial layers and how the child will be able to see after the therapeutic application of laser. We're going to demonstrate this here today. Well, as you can see here on the screen, the surface of the cornea is shown. It's been marked with this slit where it can be seen that it's blurred. What the child can see is the image next to it, the entirely blurred image of a building. After the application of therapeutic keratectomy, after the application of laser, with which we have removed the superficial blurred part, visual acuity looks like this. This is entirely normal visual function. In this picture, to the left, you can see a distorted surface of the cornea with a scar after herpetic viral infection. And here you have a picture after laser intervention in which the surface scar was removed. Here you can see blur or a scar, post-traumatic scar on the cornea, and the picture after the application of laser in which 100% visual acuity was restored to this eye. Therefore, this is a completely cured eye. As it's already been known, there's a possibility of combination in cases in which the patient has corneal blur, which can be removed by laser, and simultaneously a refractive error. In this particular case, it's hyperopia plus 4.25. The combination of PTK and PRK therapeutic application of laser provides clear surface of the cornea, transparent cornea with corrected diopter, comprising the elimination of the dependence on contact lenses at glances and the removal of corneal blur in just one action. As you have seen, the field of refractive surgery is huge, particularly the field of laser application here. Owing to developments in ophthalmology, we can use laser today in all patients, from the youngest to the oldest. You've seen that these changes occur in young children as well, these corneal scars, traumas, refractive errors, and we can solve them successfully today.
Zahvaljujući razvoju oftalmologije danas mi možemo da laser primenimo od najranijeg uzrasta do najstarijeg uzrasta, jer kao što vidite ove promene postoje od najmlađih do najstarijih, ožiljci na rožnjači, traume i refraktivne greške koje danas vrlo uspešno rešavamo.